Hello, my name is Chantel, and I decided to do my presentation on malaria, the bite of death. So what is malaria? Malaria is a disease caused by a microorganism, Plasmodium parasite. Mosquitoes are the primary carrier of this disease, and what happens is a mosquito will bite a host, and then the disease will be transmitted into the host. So the classification of malaria, it is a protozoan genus Plasmodium. Only 4 species affect humans, and those are Falciparum, which is the most severe and the most fatal, the Vivax, which accounts for most of the cases that happen in the world, and then Malaria and Oval. So here's a picture of a blood cell once it's infected. As you can see, this is when it is first bitten, all the way down to 48 to 72 hours of being bitten by malaria. So it infects the red blood cell. The toxic factors, pigment, and membrane products enter into the red blood cell. Within 48 to 72 hours after the host has been bitten, the parasite in the red blood cells rapidly multiply, which causes the red blood cells to burst and then spread through the entire body. It activates macrophages and endothelial cells, which secrete cytokines. And when severe, the progression happens quicker, resulting in more life-threatening cases. So host defense recently discovered sickle cell traits can be balanced with polymorphism, which protects against serious malaria cases. Many natives to Africa lack Duffy blood group antigens, and these antigens are surface receptors that is active in Vivax. So without the Duffy blood group, Vivax is unable to latch onto the host. Also, in malarious areas, one can acquire immunity to this disease, and they can do that through being repeatedly exposed, and their body develops antibodies which fight off the malaria antigens. The severity of malaria decreases with age, so the older you are, the less severe. So here's a picture of the mosquito gut. So here is the disease, and all the way to when it is transmitted from the salivary glands into the human. It affects the liver all the way down, and then this specific type is Falciparum. So this disease is transmitted when an infected mosquito bites a host. It can also be transmitted by inoculation of blood transfusion. So an organ transplant, a blood transfusion, sharing needles with someone, or even blood contact with an open wound can transmit malaria. Mosquitoes feed at night, so you're most likely to get bitten between dusk and dawn, and this normally happens in rural, swampy areas and areas with lots of water. Luckily, most of malaria cases have been eliminated from the U.S. and Europe. However, it's still an issue in the tropics and subtropics of South America and Africa. So here is a malaria distribution of 2016. The green is the areas that haven't been affected in over 3 years. The purple is eliminating malaria, and as you can see, the red is controlling malaria, but it's still not eliminated. And this is in northern South America and the middle part of Africa, and some parts of India as well. So what are the statistics? Well, in 2015, over half of the world was at risk for getting malaria. 70% of deaths due to malaria occurs between the ages of 0 and 5 years of age. And also, every year mortality rates are falling, but in 2015, 212 million cases of malaria were reported. Out of those cases, 429,000 deaths were reported. So here is a death rate chart. As you can see, the green is less than 1% death rate. The red and orange the red is 10 to 20%, and the orange is 5 to 9, and the yellow is 1 to 4. As you can see, Africa is the largest death rate still at this time. So just some interesting facts about malaria. per year, 10,000 travelers become ill with malaria coming home from vacation. Pregnant women are at a higher risk of contracting malaria as well as dying from malaria. And every 60 seconds, a child in Africa dies from this disease. And 3.2 billion people at one point were at risk for contracting this disease. So how is it diagnosed? Well, it requires a lot of suspicion because it doesn't occur overnight. And also the symptoms are like your common cold or flu. So it takes direct observation and blood smears examined every 6 to 12 hours for 72 hours. They also recently came out with a dipstick test, and that test for rapid antigen capture. So what are the symptoms? High fever, chills, headache, vomiting, bloody stool, muscle pains, sweating profusely, and then the more severe symptoms are a coma and convulsions. So here's just a picture of all of the areas that it targets. The spleen enlargement, stomach nausea, back pain. So can it be treated? It can be treated. The treatment of Malaria, Oval, Vivex, and some falciparum is an oral chloroquine, which is an anti-malarial drug. And the treatment of falciparum that has a resistance to the chloroquine, you take mefloquine alone, which is an anti-malarial drug, and you also take quin taken with doxycycline, which is an antibiotic. In severe cases, which mainly only occur in the P. falciparum, it's in a medical emergency, obviously. They will give you the same drugs. They will just give them to you through intravenous ways. And also you will be in an ICU where they can keep close observation. So what can we do to prevent malaria? Well, avoiding mosquito territory is one. Wearing mosquito repellent, insect repellent, stay indoors, wear covering clothes, the vaccination if you're going to an infected area, and also have chemoprophylax on hand, which is drugs that can prevent malaria. You can get those at a local doctor's office whenever you find out that you're going to an area that's been infected. So this is a diagram of how it's prevented. On the outside of your skin, it's prevented by clothes, repellents, bed nets, things of that nature. But once it's in your system, it is prevented by chemoprophylax, which is just different drugs to prevent malaria. So know your ABCs. Awareness, recognize that malaria is a disease and it is in areas still in the world. Bite prevention, take control of mosquitoes, wear protective clothing, insect repellent. Chemoprophylaxis, which is just preventative medication in case you are bitten. And diagnosis, the quicker that you get diagnosed, the quicker that you can be diagnosed and cured. And that's all. Thank you.